Whether you think abortion should be legal or not, there are a lot of problems with destigmatizing it. And by that I mean instead of treating it as this tragic necessity, people want to treat it as a morally neutral act. When we destigmatize abortion, we not only increase the cultural pressure for women to abort, we also increase the cultural pressure for various levels of government to avoid the appearance of stigmatizing abortion, which basically means they avoid regulating abortion. One of the most horrific examples of this phenomenon is the case of Kermit Gosnell. Gosnell was an abortion provider in Philadelphia, and the long and short of it is that they believe that he induced the live birth of hundreds of infants and then snipped their spinal cords, and he considered that to be basically a late-term abortion. He also caused the deaths of multiple women, and there's a laundry list of other crimes and violations to his name. If you have the time and the fortitude, you can read the grand jury report. It is not for the faint of heart. For this video, I want to focus on the section of the grand jury report called, "How did this go on so long?" In this section, the grand jury talks about multiple different departments at the state and city level who failed to investigate Gosnell despite plenty of evidence that they should. There are so many ways in which this situation was absurd, and I couldn't possibly fit it all into a TikTok, but I'm just going to read you, not even all, but some of the subheadings. The State Department of Health neglected its duty to ensure the health and safety of patients in Pennsylvania's abortion clinics. We discovered that Pennsylvania's Department of Health has deliberately chosen not to enforce laws that should afford patients at abortion clinics the same safeguards and assurances of quality health care as patients of other medical service providers. Even nail salons in Pennsylvania are monitored more closely for client safety. The State Department of Health failed to investigate Gosnell's clinic even in response to complaints. The State Department of Health monitors other comparable healthcare facilities to assure quality care. The Department of Health's decades-long neglect of its duty to ensure the health and safety of women undergoing medical procedures in abortion clinics is in stark contrast to its policies and practices with respect to procedures performed in other types of healthcare facilities. Pennsylvania's abortion regulations written by the Department of Health are totally inadequate to protect the health and safety of women at abortion clinics. The abhorrent conditions and practices inside Gosnell's clinic are directly attributable to the Pennsylvania Health Department's refusal to treat abortion clinics as ambulatory surgical facilities. Pennsylvania's Department of State neglected its duty to discipline a doctor engaged in unprofessional conduct. They talk about how the Department of State received complaints such as the fact that Gosnell had untrained staff giving anesthesia to people when he wasn't even on the premises. Also the fact that a lot of Gosnell's patients ended up being hospitalized, and yet Department of State attorneys closed these complaints without even investigating them. Even when a patient died, they didn't bother to investigate. So I guess it's no shock that they also never bothered to investigate when a patient had her uterus perforated. And this wasn't just at the state level. The Philadelphia Department of Public Health also ignored alarming warnings about Gosnell's practice. When other doctors had to treat women hospitalized because of Gosnell, did they report him? No. Gosnell was able to commit countless crimes and nobody would investigate him in the name of abortion. If you think he's the only one, ask yourself how you know that's the case.